could describe this system, it would be transportation. So it's taking blood from the heart, circulating it through your body. Your tissues in your body, which you know need oxygen to make energy, right, to be able to survive. And so this whole system is transporting that blood so that the rest of your body gets enough oxygenation so those tissues can survive and thrive. They're also taking other things that we talked about with blood specifically, like nutrients, waste products, gases, hormones, and stuff like that. So those are more like physiological things. Today we'll be talking about like the microscopic structures that make up this system. So there's two different pathways when your heart pumps blood. You have one going to the pulmonary circulation, and the other is your systemic circulation. So pulmonary, you know, is like lung, right? So that's your heart pumping blood to your lungs so that it can get oxygenated, and then it'll go back to the heart so that it can get pumped to the rest of the body. Systemic circulation is when the heart pumps everything to the rest of your body, and then it will go through a series of arteries, and we'll talk about the little increments that goes down, but eventually it'll go through capillaries, and then back up through venules and veins, back to the heart to then be recycled. So I already mentioned these two different circulations. So I mentioned the pulmonary and then the systemic. This is just giving kind of a definition of the two. One thing we'll talk about with arteries here in a second. I'll stop with that thought and I'll mention it in a minute. But this is just showing you kind of like a rough drawing of these two different systems. So your pulmonary circulation is going to be this, where it's going from the heart and then it's going to the lungs, getting oxygenated, coming back to the heart. And then your systemic is going to be the blood being pumped out of your heart, going to the rest of your body, like this would be up to your upper extremity and your brain and neck and all that good stuff, and then this is going down to your lower extremity. And so with this, kind of a note is that both systems have arteries and veins, right? If you look here, this structure is blue, and a lot of the times throughout the body, the majority, in like anatomical like pictures and stuff like that, they label the veins like being blue. But to be more technical, they're labeling the blood vessels that are have a lower oxygenation percentage compared to the arteries. So the labeling, like the red structures are going to be more oxygenated and the blue structures are going to be less oxygenated. That's just to give you a depiction on like the difference between the two structures. And we'll talk about how this one that's going from the heart to the lungs is a little different compared to the rest of the structures in the body. So we have three major types of blood vessels. Like I mentioned, we have arteries. Capillaries would be kind of its like center point where they communicate, and then we have veins. Right. So arteries are vessels that carry blood away from the heart, right? Think about the A, artery and away. Miss Siebert mentioned that she told her sister when she was taking a biology class in her undergraduate that she was having a hard time remembering that arteries are flowing away from the heart, because we'll learn in, like I said, this special blood vessel right here that's going from the heart to the lungs. It's actually an artery, even though it's carrying deoxygenated blood. And so the way that she did that, I think you said that your sister was a cheerleader?
She was.
She was. So she would be like A, away, to remember that arteries carry blood that's away from the heart.
You gotta cheer, you gotta do the hands and everything.
Funny story, I had two of my brothers were cheerleaders at one point.
Really?
So yeah, I mentioned my brother who has lupus. He actually found out he had lupus during football season. And so he couldn't play football. but he still had to go to all the games and everything. And he was like, well, I'm bored just sitting here standing on the sidelines. Like, I want to be in the game. Might as well cheer for my team. So he ended up joining the cheer team and did that during football season and basketball season. So the thing with arteries that's different than veins, the arteries are under a lot of pressure. This system on how your heart circulates this blood, we'll talk about the smooth muscle that's within these structures, but kind of a basic principle that you'll learn in physiology is that your body likes to work in a high pressure to low pressure gradient. The reason for this is because it is favorable, meaning that it doesn't have to put a lot of energy in or very little energy to be able to pump the blood through the heart. Because if it's high pressure when it's pumping blood out of the heart and the veins have low pressure, that blood's going to naturally flow from high to low pressure. And so that mechanism, like from a physiological standpoint, is also helping us to get that blood through the different structures. These walls in the arteries are a lot thicker to deal with that high pressure, and we'll go into like what these walls contain and how they're able to deal with that high amount of pressure. The smallest arteries are called arterioles. So this is right before this blood will go into capillaries. So you have arteries, and then you have smaller structures called arterioles, and then those arterioles will then flow into the capillaries, which we'll see in a second. So here's your heart. It's pumping oxygenated blood down to the rest of your, so this is like the systemic the systemic like circulation that we're talking about. So this is going to the rest of your body. You have these arteries that are really thick, and then as they get down, they get thinner and thinner, right? Until they get to the point here where they're going to meet the capillaries. So this will be your arterioles. And then we're going to talk about these things called metarterioles. It's what happens, like where the blood flows right before it gets into these capillaries, and then these sphincters that we'll mention here in a little bit, and we'll get more into that. But then they go through these capillaries, and then they will travel through some other structures we'll label here in a minute. And as you see here, you have at the beginning, there's elastic arteries because there's a lot of high pressure coming right out of the heart. You have muscular arteries, which are a little smaller, and we'll see that it's due to the amount of layers of smooth muscle that's within these tissues. And then down to the arterioles, there will be anywhere from 1 to 2 layers of smooth muscle, which we'll see in a second. So capillaries. These are the smallest blood vessels. This is the site where the exchange is going to happen with the nutrients that's in the blood, right? So oxygen and like different things that these erythrocytes or the red blood cells are carrying in this blood is going to do this exchange here in the capillaries. When they're grouped together, they're called capillary networks, or there's another term for them, which I have written, which is the capillary bed. So if somebody says like capillary bed, it's the same thing as a capillary network. So this structure here, where it has a lot of these like capillaries, would be that capillary network, the capillary bed that I'm talking about here. So here's a good depiction. It's like zoomed in on that structure we were just looking at. So here's your arteriole, right? It will flow down into these metarterioles, which is just this smaller structure right before you have these sphincters, which we'll go more in depth with. And then these are your capillaries that are meeting that information from the metarterioles and then into these venous capillaries, which will then go into the venule and then onto the vein. So we'll continue with this kind of story of how it goes from one to the next. These capillaries are very, very small. However, they are big enough to where a red blood cell can fit single file one by one through the capillary. So, and we mentioned this when we were talking about with blood, when there's a pack of red blood cells that are all lined up together. that region that picture was taken from was in the capillaries. Does anybody remember what that lineup of red blood cells is called?
Rolex.
Yep. Yep. And so you'll see there's these different layers that we'll mention here again, where it has a basement membrane, you know, it has its simple squamous endothelium, right, because there's blood cells that are going through, and some different smooth muscle and other things we'll mention here in a minute. So veins, these carry blood away from the heart. Oh no, sorry, toward the heart. So arteries away, veins go toward the heart. These are under low pressure, like I mentioned. So it's going to be favorable that the blood is going to want to flow from the high pressure to the lower pressures. That lower pressure is going to also help the veins attract this blood that's going to go back up into the heart. Because of this, the veins walls are a little thinner, so they're not as thick as the arteries. And we will actually be able to see this under the microscope, and this is going to be our main determinant of the difference between the arteries and the veins. The smallest veins are called venules, so that's what I mentioned. You have the capillaries, right, where it's joining. Then the capillaries flow into venules. Venules will then flow into larger structures called veins. The venules will, like I said, will transport this blood out of the capillaries and then flow into veins. And so here's this again. The capillaries are getting the blood from the arterioles. It's going into these venules here, and then these venules will dump into veins, will bring the blood from the rest of your body back up to your heart. And then this is like another big picture here. And this is the lymphatic system, which we'll get into, maybe not today, but we'll get into it on Monday, and then you'll go over it next week. So this is just kind of tying it all back in. So you have, you know, your artery, arterial, goes into the capillaries, the venule, and then back into the vein. And then there's like little subsections that we'll get more in depth with. So structure and function. We already talked about its function in terms of how it flows blood, whether away or toward the heart, right? So now we're going to talk about structure. You have these three layers called tunica interna, tunica media, and tunica externa, or adventitia, and then the other word for that is interna or intima. So these terms are interchangeable. If there was a question where you'd have to write that, either or term would work: tunica interna, tunica intima, or tunica externa or adventitia. A little note that I made to remember: adventitia. If you think of the root word like advent, like adventure, means you're going to go outside. So if you're going to go on adventure, you're going to go outside. And so externa is going to be like the outer layer of these structures. So tunica interna, this is the endothelial layer, right? So it's lining the lumen where all the blood vessels will be. It has a basement membrane and some loose connective tissue. And so here, this is the endothelium that we're talking about. So this would be your tunica intima, right? It's going to have that loose connective tissue on the outside, and then your basement membrane that I was mentioning. With the tunica intima, it's also going to have this internal elastic membrane. And what this does is it's going to help with the elasticity within the arteries. Like I said, there's a lot of high pressure, so it needs this elastic to be able to like stretch without breaking, right? So these elastic membranes, and we'll talk about the external one here in a minute, on how these structures will help with that elasticity to allow the artery to expand, but then also go back to its normal form. There's a little bit of smooth muscle and connective tissue within the tunica intima, but not nearly the amount that the tunica media has. So that's going to be the main layer that has the smooth muscle that we'll talk about. Okay, so with the tunica media, This has smooth muscle and elastic fibers throughout the layer. This is the layer, like I said, that has all that muscle, so it's the part that's innervated by sympathetic nervous system. And it's going to be a lot through like your like extremities, like your skeletal muscle and stuff like that, the arteries that are carrying all that blood to go out to your tissue. These sympathetics will then stimulate this smooth muscle to vasoconstrict or vasodilate. So vasoconstrict means that the diameter of the artery is going to get smaller, and dilate, if you think of like how your eyes dilate, the diameter of that artery will get bigger, right? And so this is how your sympathetic nervous system plays a role in directing where blood goes from your heart. And it does that by those structures that we talked about earlier with capillaries, the sphincters, right? So not only are they helping dilate and constrict these arteries, but then later down the road they're also helping constrict those sphincters, which then also help direct the blood. So this is the tunica media that we were talking about. This layer has the external elastic membrane and all the smooth muscle. And we'll get into which type of arteries have the certain amount of layers and stuff like that. Like I said, they start off very thick and they get thinner and thinner as they go down before they reach the capillaries. All right. Tunica externa, or adventitia. This is connective tissue that protects and reinforces the vessel. This is really interesting. There's little arteries called vasovassorum that are in your thicker, like muscular arteries and your elastic arteries that we'll talk about. The Latin root word for vasovassorum is the vessel of vessels. And so what that means is it is so big that it needs its own blood supply. So your arteries, although they're carrying blood, because they're so big at the beginning, they actually need their own blood supply to be able to fill the tissue and keep it alive and keep it strong, which blows my mind. And you'll learn in growth that your heart also has blood vessels to keep its muscle tissues alive. And so this is that outer layer that we're talking about here. So you can see these vessels that come in. Those are the vasovassorum. That's helping pull that tissue and giving it nutrients and everything. This is giving you a good depiction of the description between an artery and a vein, and then those similar layers that we were talking about. So here you can see they both have a tunica externa, right? They both have vasovassorums in the larger arteries and veins. The artery has an external elastic lamina, or elastic membrane, and an internal elastic membrane. Whereas the vein, the thing that's different with this is that a vein has valves. So veins, the reason they have valves is when blood's pumped through, down to your lower extremity or your arms and stuff like that, these valves help to close off the blood after it reaches a certain point. The valves will shut so that blood doesn't backflow the wrong way. And so it's a mechanism to help keep the blood going up to the heart. And I mentioned when we were talking about skeletal muscle, that your skeletal muscle helps pump blood up to the heart by just contracting. So that's why they say for you to get up and move every now and then so that blood's properly going back to your heart. What else? They both have the tunica intima, right? But we talked about this tunica media here, a lot thicker in the arteries. And so when we look at it under the microscope, you're going to be able to see almost like a circle, because it's able to hold its structure a lot better than the veins, whereas the veins will be kind of like flat and not as held together. And when you do it in gross dissection next semester, you'll be able to tell the difference between an artery, a vein, and a nerve. And at first, they're going to look very similar, and you're going to be like, how in the heck can I tell the difference between the two? What's nice with all these elastic fibers and these elastic membranes that's in the artery, which I don't think that we were able to actually touch the tissue during like a lab exam, but when you're doing it during like your dissection, you can actually squeeze an artery and it'll bounce back to its like shape. Whereas if you did it with the vein, it just pretty much stays flat. It's just this like little flat structure. And then with the nerve, it's going to be almost like a cord, like a rope, and really weird because there are a lot bigger structures than you would think. Like the arteries that come out from your heart, I know Mrs. Siebert has mentioned this, it's like a garden hose. It is like yay thick. Pretty great. So that'll be like stuff we'll look at. And the same with the vein, but again, it doesn't have all the smooth muscle that's within that. So because of that, the structure doesn't hold as well, and it's not able to pump blood sufficiently as the arteries do. And again, remember that the veins have that low pressure, so they need these valves to help get the blood back to the heart. Here is a slide showing you a cross section of an artery. So this is one of the bigger ones that we'll talk about here in a minute. So here, what's this up here? So you are correct. So I'm talking about these up here. Yeah. So then this would be your tunica interna, right? What is the classified tissue?
Simple squamous epithelium, like endothelium.
Endothelium. Yep. Simple squamous endothelium. So we labeled this up here. So this like the simple squamous endothelium would be your tunica intima. And then if you can see this here, this is kind of a little like wavy line, just a little bit. You can see that like darker staining. What would that structure be?
Mesolamina.
That's going to be your internal elastic membrane that we'll be able to see. This one's not as good as another slide we'll see, where it stains a lot better. You can actually see the stain. So, and then yes, there will be a basement membrane next to it. I'm saying this, the darker staining region is that elastic membrane that I mentioned, and then you'll have that basement membrane there. What is this structure from there to about here? Yeah, so that'd be your tunica media. So then what is this in the middle? Type of tissue. Smooth muscle. Yep. And then if you see, this one's a little bit better than the top region. You see all these like little squiggly lines that are kind of defining that layer. That's going to be your external elastic membrane. And then right outside of that is going to be your what? Tunica adventitia, right? Or externa. So then those are labeling each of those there. You can see if there's anything else I wanted to mention before I continue to go on. Tunica intima, part of the reason why they call it intima is because it's intimate with the blood. So that's a way you can kind of remember that. Like I said, the tunica intima has loose connective tissue, and then it has that elastic membrane. With these arteries, I mentioned it before, depending on where we're at, they can have very, like, an abundance of the smooth muscle layers, or they can have little. So directly when we leave the heart, we can have arteries that have up to 50 layers of smooth muscle, very thick. And then when we get down to the capillaries, we'll talk about ones that have between 1 and 2 layers of smooth muscle, so where it's a lot thinner. Yeah.
Sorry, can you go back to that last slide and then we spoke, like, so A was tunica externa?
Tunica intima. So if you see these red blood cells up the top corner, that's kind of your giveaway. And so this will be the simple squamous endothelium, but this whole structure, so this like line is going to be your tunica intima or interna. And then this label here, this is a little bit of a better. So it's going from this internal elastic membrane that you can faintly see. We'll see it better here in a couple slides. All of this there is going to be your tunica media, and then your external elastic membrane on there, and then this outer layer that's labeled here in C is going to be your tunica adventitia or externa. Okay, so the red blood cells are mostly the giveaway. Another thing I'll talk about here in a minute is that if you're seeing a section and you're not able to see the whole artery in a whole, it's a giveaway in terms of what type artery it is, and we'll get into that in a minute. So this tunica media that we talked about in this last slide, what is it controlled by? Say it again. Yeah, sympathetic. This is a good one. What layer creates these elastic fibers I was talking about?
What layer?
Yes.
Does the smooth muscle make it?
Yeah. So remember when I talked about smooth muscle in the muscular lecture?
They make like gags, elastic
Yep.
fibers, they
Yep.
make external lamina.
Yep.
Okay.
Yep. So that's what I was asking. So the layer that creates the elastic fibers would be the smooth muscle. Remember, smooth muscle creates this thing that you mentioned. It gags the elastic fibers, the collagen. Whereas in other places in the body, we talk about fibroblasts doing that, right? Okay. So going next, classify the tissue.
Squamous endothelium.
Yep. Classify this layer. Yep, tunica media. Yep.
So it's adventitia or externa, they're both.
Yep, they're both, simultaneous. So this next one is in like this, the red blood cells that are up here at the top, that's the giveaway that this is the interna here that you're looking at. And then once you look at these slides a lot more, you'll be able to tell the difference between the adventitia and knowing that this lumen is where the interna is at. This picture is nice because this is giving you a description of the difference between a vein and an artery. So which one do you think is the vein compared to the artery?
On the left is the vein, right is the artery.
So yeah, right is the artery, left is the vein. So you can see how I'm talking about. This tunica media is so much bigger on the artery compared to the vein. And that allows it to keep this lumen a little bit more open compared to the vein. This closes down when we have tissue prep. So yeah, this is, you can see your tunica intima, your tunica media, and then the adventitia around the outside. And then the same with the vein here. You can see the red blood cells in the middle. And then this lumen gets all squished out. And so that's kind of our giveaway to tell the difference between the two.
See the left was the vein.
Yeah, so this lumen, like you can see the artery's lumen pretty easily. The vein's lumen is going to be all squished out, so it's this region around here, and then it goes down, and then kind of up. So it gets all folded and squished because it's not as strong because it doesn't have as many smooth muscle layers. Okay, so here's another one. This one here has that elastic stain that I was talking about, so the darker structure that's like little squiggly lines following that is the internal elastic membrane.
Whoa.
We walk on the roof. And then you have the red blood cells in the middle. So this would be your artery, right? And then this structure up here would be your vein. On one of these, you can actually see a vasovasorum, that blood vessel that's sitting on the outside of these structures. Okay, so now we're going to talk about the breakdown of the arteries and the veins and talk about the specific like layers. The ones that I talked about, how arteries will start off thicker and then go smaller. So we'll go through the different structures of the arteries as they get smaller and what their names are. So these elastic arteries are going to be first that come right out of the heart. These are also called conducting arteries. As I mentioned, they have a high amount of pressure. This is going to be, your 120 millimeter mercury coming right out of the heart. It has a large amount of elastic in the tunica media, so there's going to be elastic fibers in the tunica media along with the membrane that I talked about. Major function is to transport blood away from the heart, right? So it's taking blood from the heart, dispersing it up to the brain and out to the extremities. Some examples is going to be your aorta, your brachiocephalic, common carotid, subclavian, and your common iliac arteries. These are going to be the ones that are real big, like the garden hose that I was talking about. And this one is the structure that I was talking about, that when we see it under the slide, you're not going to be able to see the whole artery. You're just going to be able to see like this one, we can see the entire artery there, whereas this structure, you just see the lumen, you don't see the whole artery as a whole. So this would be an example of an elastic artery because of how big it is on this slide. Okay, so here's another depiction of that just went on. We have our tunica intima on this side that is showing. You have your internal elastic lamina or internal elastic membrane. You have these elastic fibers that are going through your tunica media. That contains the smooth muscle. And then your adventitia on the outside. Here is the vasovasorum that's labeled here. So you can see this like little tiny vessel right there, and you can see its lumen in the middle. So as you can see, this artery is so big that it needs its own blood supply. And reading this stuff is always good for just getting extra information on some of the stuff that you're seeing here. And ask you some good questions that give you some thought to think about when you're going through these things. Here's a decent slide that's showing you kind of the elastic fibers that are going through. So those are those darker staining fibers that are going through the middle. These are specifically known as fenestrated membranes, and the reason because that we'll get into like the fenestrated capillaries that we'll talk about is because they have these pores that you can see, kind of like the gaps between them, and that allows for like communication that we'll talk about with the capillaries later. Here's this elastic stain that I was talking about. So this is going to be your artery with all these elastic fibers that are dark staining. And then you can see up here this dark staining one right before this like single endothelial layer. That's going to be your internal elastic laminar membrane. And then your external is going to be on this outside, right? So if we were to label it, it would be tunica intima, tunica media, and then adventitia, right?
Where do you say the elastic laminar membrane is? Is it on the top layers?
Yeah, so here, if you see the top, you see this darker region, like this kind of
Okay.
line, this lighter tissue.
Gotcha.
That's going to be your internal elastic membrane, and then your external is going to be this like last, like thicker layer. And there will be different stains that we use. We'll be able to pick these structures up more easily than others. And like I said, when you get a slide like this, and we're asking you to label structures, you should automatically know that this is an elastic artery that you're looking at because you're not able to see the lumen in its entirety. And again, these are not continuous, which we'll get into in a minute what that means. These are fenestrated, so they have those pores that I was talking about. And we'll get into the description of that in a minute. So we talked about the elastic artery. The companion vein is the vena cava. So you have a superior vena cava and an inferior vena cava. Those two structures are taking blood that has been, gone through the capillaries back up and then through the heart. So your aorta comes out and then it splits to go, to superior and inferior. But then these veins that are coming back, they'll have two of these vena cava that will then come up. Like I said, with veins, they are lower pressure vessels compared to the arteries. The morphology is quite different because the amount of layers that are with it, they don't have as much elasticity. And the dominant layer is going to be your tunica adventitia compared to the artery, which is the tunica media, right? So this is a picture of the vena cava. So again, this picture is depicting a vena cava, which is a very large structure. So the only difference that you have to make between the artery, elastic artery, and this is knowing the difference in the size of the smooth muscle. And you're not going to see all of those elastic fibers that we saw before. You're not going to see an internal elastic lamina or an external one. You're going to see all this smooth muscle that's going through, and it's not as big as compared to when we were looking here. You see how big that takes up the page. When we look here, it's a little smaller, but it does have some. And then the adventitia is going to be your thickest layer. In preparation, it kind of gets torn out, you'll see. Alright, so this is a good chart that describes the difference between arteries and veins. Again, I said that the veins have valves which help keep that blood from backflowing and allow it to go up more toward the heart.
Something I learned really cool about this vein, sometimes with coronary bypass surgery with the heart, they'll use your own veins to bypass the coronary arteries that are blocked. And sometimes they'll use a really long vein in your leg, sometimes one from inside your chest. But really never thought about more than just, oh cool, they can use your own body parts. But I learned this year, when they put the vein on the heart, they actually have to flip it in the opposite direction so that the valves don't block the blood flow through them. I never even thought about it. I was like, that's a really good point. So whoever's doing the surgery better make sure they knew
Could you imagine
how
if
they
it's
took it out of the
Oh
body.
no.
Yeah.
Is it like
A
a graft?
stroke.
Or is it, like, how does it,
Like how do they take it out?
Clip one in, and
yeah.
move it so
So
Okay.
won't
does
you
it
have?
go around?
Sorry, go ahead.
No, you're fine.
Won't you like have problem with the where they took out the vein though? Because there's no more blood supply there.
So you have tons and tons of veins in the
Oh,
leg.
okay.
So you might have a little more swelling than normal, but the other veins will pick up the slack.
if you're doing a surgery like that, you're gonna be like on a bypass machine where your blood's circulating through a machine rather than through your heart. So basically, this machine will be working as your heart temporarily while they're like reconnecting and cutting and sewing.
That's cool.
And there's actually a job for a person that has a bachelor's degree. I just know this because I looked into it. I was like, oh, that'd be cool. It's a bachelor's degree in like any type of like pre-med or biology and stuff like that. You can get a master's, and I forget what they call it, but basically it's this master's to where you are able to orchestrate this heart bypass machine. And so you're in a surgical unit, and you're the one that takes care of the machine, knowing how it operates, like twisting the knot, and you're working with the nurses and doctors that are there. So, like, oh yeah, I mean, it's like super interesting because like you're basically that person's heart, Like you're making sure this machine's working correctly and everything
It
like that.
sounds like a job that's gonna get replaced soon by like software.
I mean, yeah, I mean, it's not really good, but,
That's true. One day.
it's just cool, like, there's so many
It could
different
be.
options that you can take with like, just the bachelor's, like, pre-med. Like, a lot of people that are outside of this field are like, oh, what are you gonna do with a bachelor's in biology? Like, almost anything, so, yeah.
That's why I don't do anything.
Oh, I had this note to mention, when I was talking about the way that your heart pumps the blood from high pressure to low pressure, and then also using that, the smooth muscle that's through it. Think about it if you have ever seen a person, which I hope you haven't, or if you've seen like a movie where they're siphoning gas. That gas is flowing from high pressure in that tank to a low pressure that's in the bucket that's open. And so that's kind of how your heart works. Your heart is that bucket, right? And the veins are going to be that hose that is taking that high pressure gas that's in this chamber and flowing it into the bucket. So if you give a little bit of suction, it'll poof, pour out because that wants to go from high pressure to low pressure. So that's just an example of how your heart does that. And the way it does that is when it opens its valves, which we'll talk about later. It's creating that like little bucket in your ventricles that allows the blood to like suck up into your heart. So I just thought that was interesting. So next step is the muscular arteries. These are also called distributing arteries. So these are going to be the ones that you can actually see the whole lumen on the slide. They still have that internal elastic lamina, which you can see very well with the elastic stain. It has that external elastic lamina, right? Which is present in the larger muscular arteries, and they still have a vasovasorum. It's not as common as the elastic arteries have, but you may see some here and there. So this is one of the bigger muscular artery walls. Reason why you can tell it's not elastic is because of the smooth muscle layers. So you can see here there's probably 20 or so smooth muscle layers here, maybe like 10 or 15. Whereas your elastic arteries will have up to 50. Right? So that's the biggest takeaway with the difference between muscular arteries and then the elastic one. And then some of the smaller muscular arteries, like I said, you'll be able to see the whole lumen in one shot. So you still have your tunica intima, the same structures that we were talking about. In this one, because it's a little bigger, you can see an external elastic lamina, so you can see that darker staining structure going down the middle, and then your adventitia. So same type of questions that we can ask you. With this one, just know the difference between the two is the amount of smooth muscle layers that are within. Know generally how many layers are in each one. So like I said, this one could be anywhere from 3 to 20 or so, whereas the elastic one will have, closer to that 40 or 50 number. So here's another one. This is where you can see the entire lumen, and there you see all these red blood cells and, other blood cells that we talked about in the blood lecture. And you can see this tunica intima going all the way around. You see that up here, you can see it pretty well, that elastic lamina. Tunica media, which has like 10 to 15 layers, and then the adventitia on the outside. Here's another one. So this is a smaller one. So this one's going to have like the most variety in terms of the difference. So you can see these 3 different pictures. This is like the biggest you'll get for a muscular artery, a little smaller, and then this will be pretty much your smallest one. So it probably has about 3 layers, and that's going to be your kind of cutoff between a small muscular artery and an arterial, which we'll talk about next. You see all these red blood cells. You see the same type of structures that we talked about. Smooth muscle layers, just a little bit less thick. So here's a good picture that's labeling that elastic stain. So that darker region that's going through there, you can see is the elastic lamina. kind of see one on the outside here, those darker seeing elastic fibers, and then the tunica media in the middle, and then added tissue on the outside. This is a really good stain. So this is that elastic stain that I was talking about that's specifically labeling that in internal elastic membrane, right? So you can see that really well in that one. This one would probably be a good one for like labeling that, asking questions that are related with that. So for instance, like identify the elastic lamina, like this would be pointed at, like identify structure, identify layer. What is this layer controlled by? You know, the same type of questions that we already mentioned. And then ID layer as well. So homologous with the muscular arteries, but within the veins, we have medium and small veins, right? So the dominant feature again with the veins is the tunica adventitious. That outer layer is going to be a lot thicker. Your smooth muscle layer is going to be smaller. It's not going to have those elastic fibers. Tunica media is significantly reduced compared to the arteries. Another thing that I haven't mentioned yet with these veins is that they are in abundance compared to your arteries. So your arteries will always have a vein accompanying it, right? So when you talk about in gross, you'll know that the arteries always have a vein that's accompanying it, and the arteries and veins that are in that are deep, so they normally flow along the bone or right outside the beginning of the muscle. And then your veins will be all external. So the veins is actually what like nurses and like healthcare faculty will do, like for IVs and stuff like that. So they're actually going into your veins, which are in more abundance, and they're able to take up certain medicines. A lot of the times they don't want to put stuff into the artery because it'll have like an immediate effect on your tissue. Whereas if you put it in the veins, then it'll be able to like flow. However, sometimes we do go into the artery. It's this procedure that PAs or ER doctors will do. They will immediately go into one of the arteries in here or one of the bigger veins, and will go like directly into your heart. There's some cool procedures that you can look up online where they like will puncture different things, which is cool. I work at Miami Valley Hospital as a PCT, and my unit does like IV therapy. So I work with the nurses that do a lot of like IV stuff there. And then part with that, there's another like sub unit called the PIC team, and they go around the entire hospital and will put in PIC lines, which are these big tubes that will go up. This vein that's right here, and then it'll go all the way into the superior vena cava, so that they can get medicine to the heart like almost immediately for like cardiac treatments and stuff like that. And so we have this like little machine that you put on the chest as they're inserting this like tube, and it has like this like application on it, so it's like lubed up, and they inject it, and then they like shove it all the way up through, and it feeds in, and then you can see on the screen like it flowing through all the different veins. So it's pretty cool.
Like you can see it as like it's moving.
Yep. Yeah, and sometimes, which is pretty cool, I have to put on a stethoscope because if the machine's not working, which sometimes it doesn't because machines sometimes don't work, you have to do it manually to make sure that it got down in the superior vena cava. So I take a stethoscope and I will place it on their external jugular. And when that's doing, when the nurse is putting that pick in, I can actually hear it. And so I can hear it, and she'll squirt some saline in there. And if I can hear like a swoosh,
Yeah.
then I know it's going up the wrong way. And so she'll kind of back out a little bit, and then, you know, feed it back through.
Interesting.
And then if I don't hear any squishing, then I know it went down the superior vena cava, and so we know it's in the right place. And
Wow.
there's a kind of a weird estimate. It's kind of like a technique that nurses do after they get like very good at it. Is you have to determine how long the tube's going to be, right? Because you're inserting here, because you don't want to go too far and like puncture the heart, right? And so they have this like little measuring tape, and they will go through and be like, yeah, it's about 42, centimeters or whatever. And then depending on how things are when you're looking in the tube, if it is too long, then you can cut it. But if it's not long enough, then you have to restart. So there's a lot of cool stuff.
But you don't have to do that if the machine's working, right? Is that correct?
I don't have to use the stethoscope in here if the machine is working properly that day.
But you have to like guesstimate with the
With the length, yep.
Whoa.
You kind of like measure it externally because it does a pretty good job at measuring how much you're going to get, and then you always take a couple centimeters off just to be sure.
Yeah.
So
That's crazy.
it's cool.
Is your patient awake during this?
Oh yeah, 100%.
Oh no.
That's scary.
Oh,
Oh my
And we
gosh.
actually have to strap their arm to the table so they don't move too much. And so their arm is like taped to this table. And, I'm either holding their hand or describing what's going
Torture.
on. And then they put a tourniquet on, like a little band that goes around. They get the IV started, and then they start put through. It's a whole sterile procedure before like all of it up. Then you clean all your stuff up after you get it set in, and you go to the next patient somewhere in ER or ICU or wherever.
And you leave it in there for like the doctor or whatever?
That could be, yep, so you can leave that in there, or even for the nurse. Every time after we do one, X-ray will come in and take an X-ray, make sure it's in the right place. Okay, we're good to go. Start pumping them with that medicine that doctor wanted.
That's
Um,
crazy.
And they can stay in depending, so there's a PICC line and a midline. Midline will actually go into the heart. PICC line will go like right up into the superior vena cava. And so with those, they can stay for quite a long time. They can stay for like, if patients in there for months. You're gonna need an access point to give them medicine immediately if they're super sick. And so those PICC lines can stay in for quite a long time. Some patients will actually go home with them and they'll saran wrap their arm. And so when they come back in to do IVs and stuff, they will do it there, and then they will leave and go home and still have the PICC line in, and they can't like shower with it, so they saran wrap it so it doesn't get all messed up. A benefit compared to that, they have ports for like cancer patients when they're getting stuck a lot, instead of having to change out the PICC every couple months.
Yeah, that's what that was. My mom had a port. I had no idea.
Yeah, so a port is just an access to your veins and arteries that are in there. And so it's not to where you get stuck so much. It's just this little ball to
Yeah.
where the nurse doesn't have to feel for a vein or anything. She just
Yeah.
into this little tube, and then it'll like disperse it into the veins.
We see those a lot in the lab too, so it's very likely you might see one next semester during dissection. And you won't know that it's there right away until you dissect the skin off, and then you'll see this little, I've seen them white, some of them are purple. It's only about like that big. It has a silicone bump on the top that they can insert that needle into.
Yeah.
And then you follow the wire, or it looks like a wire, the line, you can see it going into the veins.
Oh wow.
Yeah, almost reminds me of like a pacemaker, how it goes through.
Yep.
They're like used for access for like chemotherapy for cancer patients. Like
That's
ports.
Yeah. It'll be the structure. It's similar to that like procedure that I was talking about, except for it's like a ball that they actually insert in your skin. So they'll put this like ball-like structure that will attach with tubes into your veins, and then they'll sew it up to where this like little ball that has this like fluid inside, which would be like all your blood, right? They can just puncture into it to where it doesn't hurt the patient as much. It doesn't bruise their arms, because I mean, if they're getting medicine every day or every other day where they have to get an IV, like their arm is just going to be all bruised up and sore, and it's going to hurt them. Getting that port helps save that patient a lot of pain.
I think they usually keep them
Yeah.
up to 2 years or
Yeah.
so after everything's good, just in case the cancer would come back.
My dad had one. He had cancer and he had one forever. And actually had to learn how to do like dressing changes and stuff with it, and then inserting a needle into it, making sure it's like sterile, and then like giving a bag of fluids like every day. So. Oh, pretty cool.
Some really cool devices they've
Yeah.
come out with, yeah.
So yeah, we were talking about medium and small veins, right? So the difference with this one, it's going to be homologous to those muscular arteries that we were talking about. It's going to have a more defined adventitia than the two media. And then the last layer we're going to talk about is arterioles, which we already mentioned, right? So the blood pressure in this structure is going to be more about 35 millimeter mercury, whereas your muscular arteries will be about 70 millimeter mercury. These are going to be the big structures that regulate the blood pressure and the blood flow into the capillary beds, right? So with that, it's going like your arteries start off with very, very high pressure, and then as it gets smaller and smaller, the blood pressure is going to decrease so that the capillaries aren't, in a sense, exploded, right, because of such high pressure. Like I said before, it's getting a red blood cell lined up single file, like down through the capillaries, and so you don't want a high pressure hose just, exploding that little tiny tube. And so this blood pressure will decrease as it goes down these structures. And with that, that's what helps regulate your blood pressure, with it being like higher or lower and stuff like that. So they still have the same structures that we've been talking about, right? But with this one, specifically with the arterial, which I mentioned earlier, is that these are going to have 1, 2, it says 3 layers, but more like 1 to 2 layers of smooth muscle. So that's going to be your biggest difference between the arterial and the muscular arteries. Sometimes there's an internal elastic lamina. It just depends on like the stain and how defined that is when we see. But the biggest takeaway when we see this is that it's going to have that like 1 to 2 layers of that smooth muscle, so you can see the nucleus there and there. So it's just going around, you see the red blood cells, endothelial cells there, and then going around and you see the adventitia around the outside. So a lot smaller, right? Here's another one. This one's kind of hard to see. It's not as like round that we're used to seeing because it's cut longitudinally. So sometimes you'll see them like this, where the preparation that you get, it's going to like chop them because you're having these arteries, especially these arterioles that are like smaller. They're going in a lot of different directions, covering a lot of tissue. So this one's cut longitudinally, but this gives a good description of the cells that are surrounding the outside. Right. So really, there's only 1 layer of smooth muscle that's on the end, and then you can see these simple squamous endothelial cells right there and there, and then the red blood cell in the middle. So here's a good depiction between the arterial here, right? And then what would this structure be? So no, this is your arterial, right? Wait.
The other one, venule or something?
Yeah, so this is your, So this would be your venule, yes. I'm looking up here, this lumen's empty, which it should have red blood cells, so that's why I was like, yeah, so this will be your artery. It's like that round structure, whereas this is your venule. It's a lot like squished out. You can see the adventitia on this one is a lot more dominant compared to, you can barely even see smooth muscle on this one.
On exams, I try to get ones that you can see red blood cells, but sometimes, depending on the tissue preparation, sometimes they're not there. But on an exam, I've tried as hard as I can find one with red blood cells for you.
So, what is this? Yeah.
Capillary, red blood cell and a capillary.
Red blood cell, yep. So you can see this around, this would be your endothelial cells, right? And then you can see your smooth muscle cell nucleus there. wrapping around. Any guess what this structure is that's going around?
Is that the elastic lamina?
Do you know what the structures are on like the bottom right?
These here?
Yeah. Are those nerves? Like Schwann cells?
Yep.
That's cool.
Really?
Hmm? You see the
Interesting.
myelin, the dark myelin that's around them?
Yeah.
Ooh.
So then this is obviously your smooth muscle, right? And so this is a bundle of nerve fibers that are coming in to innervate the smooth muscle.
More at the nerve rate.
Wow.
Any questions on this stuff as we continue to go through? Next, we're gonna catch up with capillaries here in a minute. After this next slide, we'll take a 5-minute break. We'll come back.
I kind of have a question about, so you have like endothelium, right, that makes, you said there's a basement membrane, okay, and then towards the tunica adventitia, there's an internal elastic like layer. What's that called again?
So, when we're looking at these, this will have, especially on the bigger structures,
Yeah.
in the tunica intima, so this layer that's the endothelial layer,
Yes.
it'll have a internal elastic membrane, or internal elastic lamina.
Okay.
And the tunica media, on the outer end of the tunica media, will have a external elastic lamina or membrane.
Yeah.
And then it'll be the tunica adventitia surrounding all of it.
Okay, cool. So, so there's a basement membrane. I thought the smooth muscle cells made the external lamina, which is,
The basement membrane's in between, so you have the endothelium, then you have a basement membrane, then you have the internal elastic lamina.
so where is the external lamina that the smooth muscle cells make?
It's on the very outer edge of the tunica media.
Okay.
Like here, with this picture. So this
Yep.
is gonna be your internal elastic lamina, this darker structure. The basement membrane will be right above that, and this is gonna be your.
You have a little bit
layer.
of loose connective tissue under the endothelium as well.
And
We
then-
talked about some endothelial connective tissue way back at the end of connective tissue lecture. You have a little bit of that there.
And then the external is gonna be right on the outside. This is kind of depicting a little bit of that elastic fibers. So it's just the outer layer. And then sometimes you'll see this darker staining elastic lamina on your tunica media and then your adventitious on the very outside. You can draw a picture if you want.
I think that picture was good.
Alright, so ending with venules, you have post-capillary venules, and then you have these muscular venules, right? So, the post-capillary ones consist of the very thin endothelium. These are surrounded by reticular fibers and structures called pericytes, which we'll see here in a little bit, which just help with supporting around where the capillaries are. And then you have these muscular venules, which are associated with the arterioles, right? They're a little bit bigger in diameter. And then they're surrounded by more smooth muscle. So here you can see there's about one layer of the smooth muscle that's going around. Like there's the nucleus of one, and then the adventitious right outside. So not a very thick layer. This lumen's like squished out more. You see your endothelial layer, so this is why it's the smooth visual, sorry.
If you look at the diameter of the lumen in comparison to the thickness of the wall, that lumen's like, wow, that's big in comparison to the wall. We have the arterial, the lumen, wasn't huge in comparison to the thickness of the wall. That's something I look for.
If you look on the next picture, you can kind of see a big difference. Of what she's talking about. You're seeing the size of this lumen compared to the wall from this structure, right? And this one here. So this one has about, a little bit more than probably 3 layers if you count, like there's 1, there's 2, there's 3. So this one is still considered that small muscular artery. And this is going to be your venule, which has barely 1 layer of the smooth muscle, right? And when she's talking about this lumen compared to the smooth muscle layer, you're seeing that this lumen is a lot more round, and then you're seeing this thicker smooth muscle layer. As compared to here, the lumen's very large, and it has a small smooth muscle layer. Right? So large lumen, small smooth muscle layer, or tunica media. You're looking at a venule, most likely.
That one is not arterial, right? That's an artery?
Yeah, this is an artery.
Okay.
And so the reason, like I said, because of that is because of the layers.
Okay.
With it, it has, more than 2 layers of smooth muscle. It's still considered that small muscular artery. If it becomes 1 and 2, then that's when it's going to be considered an arteriole. And if
Okay.
you look on this picture here, it's like actual descriptions that arteries with a diameter of less than 0.1 millimeter are considered arterioles. And so that's how they actually define, well, that's an artery, that's an arteriole.
Okay.
But for the general sake, we're just going to go off with the smooth muscle layers. Capillaries are next, so let's take a 5-minute break, and then we'll come back to it, and we'll try to get as far as we can.
Can
So
you?
when they were making these definitions, they busted out some calipers and
Yeah, so movies, and it's nice, there's a, Dr. Ladle, has the lab which I work in. He has, these, what's it called? Oh, it's called spot scope, or, it's like a certain name for a type of scope. And it uses the same slides that we use right here, right? And it has a similar structure, except for this is hooked up to a very fancy camera. And so that camera actually has a little input of a caliper in it, to where it can go over and measure the size of structure that you're looking under the microscope to get an actual depiction of what you're looking at.
Huh, interesting.
So that's how they do that.
Can you draw out the one you mentioned earlier? So it started with these epithelium or endothelium, then the basal lamina or basal membrane or something, and then
Yeah, so if you're doing the layers, the very, very inside, so let's see, so the very, very inside layer is the simple squamous endothelium. And then just all epithelial tissue, we have a basement membrane. And then there's a little bit of subendothelial connective tissue. And then you have a squiggly
You see something connective tissue?
subendothelial.
Subendothelial.
Yeah, so sub just means below.
Okay.
Two subendothelial.
Connective tissue.
Yeah, it's just connective tissue.
Okay.
that's made by the endothelial cells.
Correct.
So the type 3 collagen.
Membrane. Yeah, type.
And is it-
type 4.
Plastic.
The connective tissue, you said it was loose.
Yeah, loose connective tissue.
just have endothelial connective tissue and up is considered intimate because it's made by endothelium.
And the endothelium makes part of the basement membrane, and then this is just normal connective tissue with like fibroblasts.
Oh, okay.
Yeah.
So to the media and extra elastic lamina is the media tunica.
And then you have that.
So internal and external both.
Yeah. That's right. Connective tissue, external. Yeah, these two almost give us a nice border
Yeah.
between
The
intimate
elastic.
media and media.
Okay.
Yeah.
Awesome. Does that apply to all the venues, so your artery veins and all that?
Usually we see the internal and external elastic lamina better with the larger vessels
Okay.
and the muscular
Okay.
arteries.
Nice.
So, yeah, not like, once you get to arterials, it becomes very difficult to see either of those. And these are things that are more associated with arteries.
So would that be considered a way to identify them, like you don't see the elastic? Ah, okay, that'll be the arterial or some kind of vein.
Yeah, I would
What do
maybe
you
try to like look
use?
for a lot of things and not just.
Just one, okay.
Yeah, because especially like the stains, these aren't gonna help you much unless it's an elastic stain. So I would be looking at how thick is the tunica media compared to the tunica externa. Tunica media and artery. So this is thicker in artery than in veins. And this is thicker in veins than in arteries. Yeah, so looking at that, looking at overall size compared to the lumen. And as we go through the last part next to
So like, the lumen as well.
yeah, the size of the lumen compared to the thickness of the wall, the shape of the vessel sometimes is helpful. There's a lot of things to,
Yeah, I
Yeah,
think I
look
got
at
tricked.
not
I got tricked
just
because of the lumen. I was always assuming, oh, it's a nice and round, or it's compact as a vein, like, whoa.
yeah, the lumen, and even sometimes on
Eric,
arteries
what
is
happened?
not perfect depending on where we are.
What happened?
Thank you.
Did she say you get your life back tomorrow?
Oh, no, iPad.
iPad.
Oh, yeah. I ordered like a month and a half ago.
Nice.
Yeah.
Delays for COVID. Everything's delayed for COVID. It took us 2 months to get lumber to a deck. Yeah.
Yeah. My brother was putting up a fence, and we had to buy like timbers instead of 4x4s because 4x4s are like $30 a piece right now. Timbers
Yeah,
are only like
everything went
$5.
up like right after we bought it. Thank goodness we bought when we did.
Good idea.
Yeah. Yeah. I just got that new picture. That could have worked. It's crazy.
It is.
All the different things.
an electrician, and they need breakers because they're switching over like panels for winters, and the breakers for electric panels are bought out in December. So you can't like do anything with,
Oh my gosh. Canning stuff too.
what?
Like all the canning stuff. The jars.
Oh,
and
yeah,
lids.
Kelly and I.
Yeah. My mother-in-law always does a lot of canning, so we get like jellies and jams and stuff, but not this year. It's like, sorry, can't do anything. Darn COVID.
Everything revolving like hobbies and home improvement. So people got like stimulus check and a bunch of free time, so.
Yeah, yeah.
Everybody's
Finding
making bread.
projects.
Everybody's making bread. There's like
Yeah.
yeast shortage.
Yeah, my wife made bread.
Yeah, I did too, I did too.
It's great.
The trend. It's fun.
I'm in Alfredo.
Alfredo?
Yeah, I got as a
That's the
wedding
way to
gift
do it.
from my Italian friend. She gave me a, this pasta roller. So you like attach it to the counter and crank it, and it like flattens out the dough. And you put it through these like, you can choose your like setting. And if you either do fettuccine or spaghetti noodles. And then this has this cookbook that can teach you how to wrap the pasta around like straws and stuff to make like macaroni noodles. Like pinch it, bow tie. So it's super easy. Because all it is flour and eggs, a little bit of water.
Yeah.
And then you just sit there and go at it. And you, it's incredible.
It's really cool.
when I make my own noodles, I literally have to like get out a pizza cutter and like just, and it takes forever. I wanna get one of those for like my stand mixer.
Yeah.
Those are really nice.
Which, I mean, they're like anywhere from like 40 to 50 bucks, or I think you can get ones that are like 80, but
That's a nice gift.
it's worth it if you're gonna make noodles. Like, I'm not gonna do it all the time, but I'll do it for special occasions.
Yeah.
And I made homemade Alfredo sauce. You've
So
never had
much.
homemade Alfredo, it's like literally amazing.
So much better.
You just take heavy cream, you get from the store just like 2 or whatever, I think it's a liter of it. Pour the pot, stick the cream cheese, stick the butter, stir it around, season it with salt, pepper, and garlic. Oh my
So
gosh.
good.
It's literally the best thing. Alright.
Take latte. Or like,
A what?
A bucatini. It's a long, it looks sort of like a spaghetti noodle.
oh,
but
are
it
those
has
the
like-
hollow ones?
Yeah.
Yeah, those are good.
Where do you find those? They're small,
Stores?
like, they look like this.
Yeah, I saw those in a recipe. I have no idea, I've never seen this.
I've never seen them in the
I never
store.
heard of them until we were in the dissection lab and we were doing stuff with arteries. And they're like, these arteries look like bucatini. Like, what's a bucatini?
I've never heard that.
Like, great, now we bucatini noodles.
But like if you were making your
Yeah.
own and you have straws, you just wrap the dough around the straw
True.
and then pull it off, let it dry.
Be a very big bucatini.
Yeah.
I'm sure if you look at like Whole Foods, you can definitely find it.
Amazon.
I like the burger.
Yeah, Amazon.
Yeah. Or if you go to like, I think TJ Maxx occasionally has pasta, it's sketchy.
Hey, what? What? I thought they sold like clothes or something.
Yeah, but they also have like random jars of food.
Sometimes, yeah, sometimes it does.
Huh.
Like you saying something that we can find out.
I would've never
Come time for
guessed.
lunch. Alright guys, let's
Capillaries.
let's finish as we can so that Monday you have this whole lecture.
Let's see how far we go. It's so much
TBL's
material.
on Wednesday. And it's gonna cover this up to the rest of this lecture. So we're gonna finish it today, and whenever I don't get finished today, we'll finish Monday, and that's what's gonna be on your exam, so it'll be 3 lectures.
Oh,
Or TBL, sorry, not exam.
3?
wait a second, I'm a little confused. Is it, so the TBL will still have muscle and
No.
blood? Okay.
It's just gonna have blood, hematopoiesis, and then this lecture that we're doing today. And then the exam covers everything, plus lymphatics,
Oh,
which we'll go over next week. So what's nice is you've already studied super hard for TBL number 1, right? So you should have nervous and muscular system stuff down. Next, you'll have the stuff that we're going over. You're gonna study hard this weekend, do well on the TBL on Wednesday. And then the only thing else you have to learn is lymphatic system next week. Review it all that following weekend, and then you'll be ready for the exam.
Oh
It's
man.
not too terrible.
Bam,
It's these
bam.
3 lectures, and then just anything that we learn on Tuesday, just throw it out of your head until Wednesday's over.
Well, at least neuro is not anywhere near around this time. Huh.
That
You just let my
neuro
blood
curve.
pressure go up.
That neuro curve.
So that'd be your sympathetic nervous system, right?
He's a saint.
I guess.
Oh, yeah, so that's a cool thing. I'll start with that, and then I'll tie into your capillaries.
Guess I don't have to
Is
put it.
that your sympathetic nervous system controls the smooth muscle that's going out to your extremities, right? Parasympathetic is the main one that deals with the stuff, controlling and dilating the arteries that are in your organs. And so what's interesting when they talk about parasympathetic versus sympathetic, they always say they're like completely opposite. Like when one's turned on, the other one's turned off. In reality, that's not true. Reality of it is that they're both turned on, but in different circumstances in different parts of the body. So for instance, if you see a bear, your fight or flight's gonna turn on, right? You're gonna get all like worked up. You're gonna either think, okay, can I fight this bear? If it's a black bear, right? I gotta get all up and scary so that it runs away. If it's a grizzly bear,
I'm fighting it.
you gotta flee, or you gotta like do the fetal position. But that's my